Hello friends, this is the first video of a series. Today I will discuss about skin aging. See, I don't think immortality is something that we can achieve in the future, but eternal youth is something on which topic there is multiple research and studies are going on, and maybe in future, in someday, we can achieve that. So, what is actually skin aging? You see, every organ in our body ages. With age, every organ of our body get damaged, but we cannot see that how much our heart or our lung or our kidney has become older with age. But what we can see from outside is our skin. So skin, hair, nail, teeth, these are the main parts that reflect our age, because these parts are visible to everyone, and it is not only a cosmetic concern but a medical concern as well. Now see, skin aging is consists of mainly two parts: intrinsic aging and extrinsic aging. Intrinsic aging is basically chronological aging, which is a normal process which occurs over the lifetime of an individual. It particularly occurs over the areas which are protected from ultraviolet radiation of sun, like the inner aspect of our upper arm and inner aspect of our thighs and buttocks. It basically looks dry with fine wrinkles. Extrinsic aging is mainly consists of photoaging or damage of our skin due to sun exposure, particularly ultraviolet rays of sun exposure, which mainly occurs over the sun exposed areas like our face, upper chest, neck, our lateral side of the forearm, and dorsum of our hand. Now, intrinsic aging is inevitable. So, extrinsic aging always occurs over the intrinsic aging. See, on the basis of clinical features or how it looks, extrinsic aging is consist of mainly two types. I am not going into the details, but just remember two names: atrophic photoaging and hypertrophic photoaging. In atrophic variant, fine wrinkles are more prominent and there is discoloration of the skin. Some parts of the skin becomes darker and some parts of the skin becomes lighter, which is also called dyspigmentation. And most importantly, this variant is very commonly associated with skin cancer. On the other hand, hypertrophic variant presents with coarse wrinkles, homogeneous color, and with less chance of getting skin cancer. Before going further, as always, let me remind you to subscribe to my channel and do hit the bell icon. Now, I will like to discuss some other factors which are associated with skin aging, like smoking. See, smoking actually accelerates skin aging by damaging our elastic fiber present in the skin. The smoker's face particularly consists of wrinkles radiating at a 90-degree angle from our eyes and lips. Along with that, uneven complexion and a greyish hue may be present over our skin. Now, another important part of skin aging is appearance of small white patches over our arms and legs, which is called idiopathic gutted hypomelanosis. I have already made a blog on this topic. I will share the link in the description. For more information, you can click on it and read it. Senile purpura is another important part which is seen in aged individuals, where there is appearance of deep red or bluish red patches over the skin due to some trauma or sometimes without any trauma. Apart from aging, this particular sign may also be present in patients who take anticoagulants or drugs which inhibit our blood coagulation process, like aspirin, warfarin, etc. Is there any genetic factor that is associated with skin aging? Well, multiple research have found that a gene called MCR1 which regulates our skin color is actually associated with skin aging. Now let me discuss very briefly what is the mechanism of skin aging. The main part of our skin consists of collagen fibers, particularly type 1 collagen, and in case of both intrinsic and extrinsic aging, these collagen fibers get damaged. Now, the most important part, what are the implications or effects of skin aging? Now, if you like the video so far, please subscribe to my channel for more content like this, and do like, share and comment. Now let's move into the topic. The first one is medical implication. See, our skin acts as a barrier for water loss, and it also prevent invasion of microorganisms like bacteria and viruses, and also protect us from various allergic substances. With aging, this barrier function of skin becomes hampered, for which the skin becomes more dry and more itchy. Along with that, there is higher chance of skin infection and skin allergies. Along with this, I would like to mention a special term called dermatoporosis, in which there is atrophy of the skin. Along with that, fissures and cracks appear over the skin, which leads to easy bruising and sometimes bleeding. Senile purpura can be thought as a part of initial stage of dermatoporosis. Now, the second one is cosmetic concern or cosmetic implications. Cosmetic concern mostly related to wrinkles over our skin, laxity or looseness of our skin, uneven skin tone or dyspigmentation, and excessive dry, dull and rough skin. And the third and last part is social implications. We all know the social importance of a beautiful skin. Gorgeous looking skin is not only a sign of youth, but a very good looking skin gives an individual an overall attractive appearance, which is very important for him or her to get increased opportunities in both professional as well as personal life. So, now the burning question is it possible to prevent or reverse skin aging, or if yes, how? We will definitely enlighten you all on this topic in our upcoming videos in this series. Wait, don't just leave yet. You have an important work to do, and that is subscribe to my channel and hit the bell icon. We will meet in our next video. Till then, take care, be safe and goodbye.